Well, good morning. Welcome to Cloverdale Mall, one of 3 new city-run mass vaccination clinics that will be opening up tomorrow for the first time. And I'm very pleased to be joined here by Member of Parliament for Etobicoke Lakeshore, James Maloney, Member of Provincial Parliament for Etobicoke Lakeshore, Christine Hogarth, and Mark Grimes sends his regrets he couldn't be here today. But of course, as has been the case on all of these clinic openings and tours, I'm very pleased to be joined by Councillor Joe Cressy, the Chair of the Board of Health, Dr. Eileen de Villa, the Medical Officer of Health for Toronto, and Chief Matthew Pegg, who's been so much an integral part of running the emergency management part of this entire pandemic, including our vaccination effort. This is an exciting moment for our city. Each time that we've been able to roll out our vaccination capacity and increase it has been an exciting moment for us. We will now have 9 city-run clinics as of tomorrow up and running across the city. They are such an important part of our Team Toronto approach. We've seen how successful and critical that these sites have been in our effort to vaccinate Toronto residents as quickly as possible. The opening of this new clinic, along with clinics at the Carmine Stefano Community Centre and the North Toronto Memorial Community Centre, represent the continued progress that we are making in our Toronto team effort to get the shots into the arms of our residents. More than 710,852 shots and counting doses have been administered in Toronto so far. That's by our city clinics, hospitals, healthcare teams, and pharmacists. This weekend, 6 of our city-run mega sites are open, and 34 clinics are being run across the city by our hospital and healthcare partners, and that's this weekend alone. With the current supply from the other governments, these city-run clinics will be able to vaccinate approximately 8,046 people a day and 56,322 a week. With some eligibility changes and people getting aboard, we really are ramping up towards a capacity for these clinics based on committed supply. For context, at this clinic alone, we will be vaccinating approximately 1,620 clients per day and 11,340 clients per week. That's at this location alone at Cloverdale. That's one of the new clinics. And they can step up those efforts as we obtain more supply through the Government of Canada. We're here today because we can't say often enough to people, please get vaccinated. And I should say here at Cloverdale, they make it very comfortable by adding one thing that we haven't seen at the other clinics, which is art that has been put on display through the Humber Valley Art Club to make the experience even more pleasant. But all the reports that we've had so far from people who visited any of the existing city-run vaccination clinics have told of an easy experience, a comfortable experience, a relatively fast experience, and we're proud of that, and we're continuing to refine how we operate those clinics in order to make it even more comfortable and even better an experience for those who we want to get vaccinated, because we know that's part of what's going to encourage people to get it done. I'm urging people to get registered and to get vaccinated if they are eligible. I got my vaccination over the course of the weekend. If you are 55 and older, like me, you can get your vaccine at a pharmacy in the city. For me, I can describe it only as a seamless, safe experience, and aside from a bit of restless sleep, I will now begin to build protection against this virus and without side effects. And in my case, it was the AstraZeneca vaccine that was administered to me in the pharmacy setting. On Friday, we also opened up registration online and by telephone to anyone 50 plus in hotspot neighborhoods. So that's determined by postal code, and it is a list of postal codes identified by the province of Ontario for vaccination in the city-run clinics. So if you are in one of those postal codes and you are 50 plus, you are now eligible to use the provincial registration system to book an appointment here at this clinic or at one of the other 8 that will be open as of Monday. Thousands of people, in fact, booked their appointments in the first few hours of that changed eligibility, and we hope that thousands more will continue to do so through the beginning of the week. Registration is simple and easy. You can either go to toronto.ca/COVID-19 and you'll find the steps there with your health card, an email address or a phone number and your date of birth to be relatively easy. And there's a big blue button there that says book a vaccine, so it's pretty easy. If you're not comfortable with that method of registration, you can call the provincial call centre at 1-888-999-6488. And again, everything we've been told is that the experience of registering either by phone or online is relatively straightforward. And it's not just about you. If you know someone who is eligible at this point in time to get the vaccine based on their age or based on where they live, please check in on them and help them or offer to help them to book their vaccination or help them to get to an appointment for a vaccination, because there are some people that are hesitating because they are nervous about the registration process or nervous about the process of getting to and from these clinics. We can all play a role in helping people to get vaccinated. And the more shots in arms, frankly, the faster we can get out of what is, I know, a very difficult and troubling situation for people across the city and right across the province. I also want to reassure residents that work is underway to address the expansion of eligibility to 18+ for residents living in the hotspot neighbourhoods. Clinics are happening now and have happened over the course of this weekend and into next week in a number of those postal code neighbourhoods, but we want to make access to vaccination for those people even easier, and we're working at that and at increasing the number of those pop-up and mobile clinics that we have across the city. But we already have, as I mentioned, 34 clinics over the course of the weekend, and we've had similar numbers during the week, so there are far more choices than just what will be 9 city-run clinics, mass vaccination clinics, as of Monday. Our city-run clinics will accommodate those 50+ in these hotspots, but we are actively working with our health partners and hospitals to open more pop-up and mobile clinics to make sure that we get shots in the arms of as many residents as possible in these hotspot neighbourhoods. We will have more to say on that soon, and we'll be working with our health partners to roll more of this out. In the meantime, if you are eligible now, please consider getting vaccinated. We have appointments available, although they are booking up at our city-run clinics. The vaccine is a major source of our hope to put this pandemic behind us. That and keeping distance. Distance and vaccination are our 2 best tools to fight the pandemic and to fight the alarming spread of both the virus and the variants that you are hearing so much about. So we need residents to do their part and to keep their distance and to get vaccinated. I want to conclude by thanking the city staff and the staff across the board, from Toronto Public Health, from the emergency services, from every corner, and the other 2 governments as well have been very helpful partners to us in making sure that we can have an effective vaccination program in the city of Toronto. This is the largest vaccination effort in the history of the city, and so it is a big and very complex undertaking, as you've seen. But with the help of the other governments and the help of a great, hard-working city staff, we have managed to come as far as we have with much more distance to go. The next couple of weeks are going to be difficult. They're going to be difficult in a number of respects. Of course, we have the stay-at-home order and the emergency orders in place, and that makes it difficult for people in many different respects. But it's also going to be difficult because the projections that we've seen over time, which unfortunately have been quite accurate, tell us of higher case counts, and they tell us of the tremendous strain that is being placed on our hospital system, including in particular our ICUs, our intensive care units, and our medical professionals, our healthcare professionals. So that means a really disciplined school break week, Stay home, no outside of home play dates or visitors. We really do have the opportunity to make significant progress during the combination of the school break week, following the rules, and the emergency orders that are in place to make a big dent in some of these projections and in the growth that we've seen of the virus and the variants in our city and beyond. And it really just means no unnecessary trips out of home for the next period of time and no socializing other than people that you live with. I know that we can do better. Our collective efforts and your response are proving that, because you have come forward now with greater momentum to get vaccinated, and people are really making an effort, I believe, to follow the rules. But that collective effort going forward over the next couple of very difficult weeks is going to help us, and I think if we show the same collective determination across the board on distancing, on the lack of socializing, on the wearing of masks, and on getting vaccinated, there really is hope that we can be in a much better place not too long from now. And so we're here to answer any questions you may have, but we thank you for your patience. We thank you for your cooperation in signing up and helping others to sign up. We thank you for your cooperation with public health measures, and we look forward to better days ahead. Any questions?
I guess just an update, how are you feeling today? And also, since you've had the shot, can you talk about maybe your state of mind? Do you feel any better knowing that, it's very early right now, but knowing down the road that you're going to be better protected?
I can tell everybody who has not yet had a shot that you will feel better about the beginnings of protection, but I've also listened to Dr. Davila and others enough to know that it's not an instant solution. It does not take away from the fact you have to keep your distance. It does not take away from the fact that you have to avoid socializing with people you don't live with and all of those things, wearing of masks. And so, but it is a relief that you've started that process of providing yourself with protection with a second shot to come. And so in that sense, and I will say to people that I feel fine today. You know, I had a bit of a restless sleep. I feel maybe like somebody gave me a little punch in the arm, but nothing that's even serious. You'd hardly notice it if you didn't remember that you'd had the shot. And I also feel entirely confident that the AstraZeneca vaccine that I was given was safe because they wouldn't let me or anybody else get it. Millions of people around the world have had the AstraZeneca vaccine safely, and it is beginning to provide protection for them. And I think that's why people can go confidently to any of these clinics or to the pharmacies or to the hospitals or anywhere else and get any of these vaccines and begin the process of protecting themselves. Okay. Thank you very much.